And we are so lucky that we get the amazing presentation of Healthcare Leadership in Dynamic Times presented by Ann Jordan, JD, President and CEO of HFMA. So welcome, Ann. Thank you for joining us. So I'm going to have Ann come up. I'm going to introduce her. So Ann Jordan is a solve-based, system-oriented strategist. She is dedicated to advancing the mission, impact, and positioning of HFMA to meet its opportunities and challenges in this dynamic U.S. healthcare system. As the first woman to hold this position in HFMA's 77-year history, Jordan brings a member-focused, value-driven approach to the organization. She is the advocate for professional development and deeply enjoys engaging with the organization's 60-plus chapters and councils. Wow, that's a lot. That's a lot of travel. Embodying the belief that every member, from student to CFO, should feel a sense of belonging, purpose, and empowerment. Ann, please take it away.
Thank you so much, and good afternoon, everyone. First, let's give a big round of applause for Marnie and set her off for a great year ahead. And to Ann, who I think had to stop out for the leadership that she provided in the last year. This chapter is definitely in good hands. So thank you for the introduction. I'll start by saying this is not going to be your typical leadership speech. For a lot of reasons, and that begins with the fact that leadership takes a lot of forms, and it's very unique with respect to healthcare. And I say that to set the stage because healthcare, unlike a lot of industries, truly has no leader. It is the culmination of many stakeholders. So when we're trying to capture leadership in healthcare and pile on the dynamicism, I like to call it uber dynamic right now, of what is going on, what lens do we bring to the table in terms of determining what is effective leadership, and from whose perspective determines whether or not there's progress, right? So things get a little complicated. The other reason why this time together is going to be a little different is often you go to seminars, conferences, and someone is trying to educate you and advocate what you should think. This is going to be two ways. So a lot of times you're told, put your phones away before you go to the movie theater. I'm saying the opposite, get your phones ready because this is interactive. There is a lot of Slido involved in this presentation. Why am I doing that? We're a membership association of over 132,000. I'll get to that later. I need to know what's going on in the field. As much as I need to talk to a thought leader in an ivory tower, I need to talk to you, the members. And so part of my engagement when I go out there is to receive feedback from you and compare that data to what we're receiving from individuals. A lot of organizations pay millions and millions of dollars to give insights, right? So I hope we all leave today together gaining a lot. I know I will. I also can tell you I'm using this room as a test pilot. HFMA is going through its business planning to create its next strategic plan. We're in those final prep months. I have included some slides in here to check and see whether or not we're going on the right path so I can include it in the board book. So you guys are an incubation machine right now to make sure that we at National and the board of directors are not disconnected from what you're thinking. All right? So I'm really excited to look forward to what's coming. This is one of those presentations where I can't even tell you what's coming because it's going to be dependent upon some of the answers that you give. So our journey today, 3 parts. 1, insights for industry leadership. The second one is striving for financial sustainability and outcomes. There's going to be some juicy tidbits there. And finally, embracing and celebrating a solve-based mindset. And we're going to do that with respect to member value, as well as where we go next, not just for HFMA, but the overall healthcare industry. I have now been in this role for a little over 18 months. Some days I feel like it's been one day. Others I feel like a part of this community for 10 years. In the 77-year history, I am the first woman. I'm also the first association management executive. That's different. And so the beauty of my relationship with the members is that I take the expertise that you have in healthcare finance and I combine it with my skill set in systems design, problem solving, data analytics, association management, and risk management. And we form a marriage for value, right? So this is a little bit of an experiment for HFMA. And so when I try to explain how am I viewing this organization, what is the roadmap? When I started last year, Dennis Dahlin-Amaya was the chair of the board. And day 2, he said, what's your roadmap for this place? And I said, I thought we'd get a week before we had that conversation. But here it is. We're going to optimize and create a system around these 3 concepts: member value, mission impact, and organizational excellence. That's your roadmap. That's the way we break down whether or not we are moving forward and progressing in a lot of which we do. This to me is something I think about every day when I wake up as a CEO. I'm one of those people that believe in accountability. And if I'm not taking us forward in these 3 areas, I am not doing my job. So a lot of times when I come out and talk to the members, you're going to hear me ask about those issues, looking at metrics about these issues and giving transparency to where we need to improve. Before we dig into kind of the core leadership elements, I want to express, number 1, how grateful I am to see that this local chapter already embraces the element of belonging. At the end of the day, HFMA is nothing unless we are able to bring together people so that they feel that they are in a safe space to learn, to exchange ideas, right? To learn and grow. 2 hashtags that I live by: 1, solve big problems; 2, you belong here. And I want to make sure that every place that HFMA is, that spirit of belonging, no matter what the characteristic be, is there. Why is that foundational to leadership? Because as I said at the beginning, when you are in an industry with severely divergent stakeholders looking for something different, if you want to see progress, you need to create an environment where there is the capability to have the safe exchange of ideas and you celebrate the diversity of thought. We're going to dig into some data later that shows highlights about what people think is coming for healthcare in terms of change. One of the key takeaways is a lot of that's beyond our control. So how to respond to that? How do we have the tools and resources to do it? We need to make sure we set up an environment where we're capable of learning. So again, I see that in this chapter. I want to thank the leadership. A lot of the conversations that I heard this morning were about how do we get more people in, right? How do we tell people what we're doing? And that is so critical, so thank you. I stated earlier, the state of our union is strong. That's a blessing right now. So many associations are in a different situation where they're not seeing this growth, they're not seeing this energy. HFMA, over the course of the less than 2 years I've been here, has grown 30%. We are now sitting at 132,000 members, right? And there's growing pains with that. I hear it. One of them is figuring out how we can better engage our enterprise members and get those people on the ground to participate in our chapters. I hear that. We're going to understand it. But also when we're at a place where we have this opportunity to lead, what does that mean? We've not been in this position before. When you think of associations, we have opportunities for impact at 3 levels. I call them the micro, meso, and the macro. Micro is the individual, right? The learner going on their journey. The second is the meso, the organization that they're a part of. And this third one, new for HFMA, macro. Historically, HFMA has not looked at what it can do outside of its walls to healthcare. We really have looked at advancing financial management and staying within our walls. What does that obligation in terms of leadership look like now that we are at a position of greater strength? Coming up in the future years for HFMA, not only are you going to see that element of macro, we're going to come back to it, but I want to start with HFMA core value to our membership. Over the course of the last 18 months I've been here, we've dived into what is the future of member value, and so how can HFMA get a forward on that dialogue. It started with talent at headquarters, right? You're going to start seeing new faces and new names in addition to those that you know that are already giving tremendous service and value to you, starting with the head executive that leads membership. Her name is Stephanie Denver. She's been here 2 months. So member value is going to be a key point of interest at our board of directors. This kind of begins our Slido interaction, just for me to get a pulse of what I'm hearing again at headquarters and the board of directors. It's going to be quite a few of these throughout the presentation. But for me to understand at the beginning in this chapter, what is the biggest value of HFMA membership? I can tell you what people tell me it is when I'm at the top, but actually understanding what you see. And I'll give you a second here. Yep, they're starting with networking. See, and already this is a value, because if you talk to the top echelons of leadership, they would say education. So depending upon where you are and what we need to look at and how we measure whether or not we're delivering member value, these are the type of things we need to learn. Also, local chapter leadership, hopefully this helps you too. You can see what your room is thinking when you describe member value. So lots of different opportunities here. And again, thank you, because I take all of this back to make sure that we have a good pulse. So as HFMA and its new strategic plan, what's coming, we're looking at member value. You're going to see increased attention on community and events in particular, as well as overall member value proposition. So thank you. Now jumping into the macro, which is where we're going to spend the most of our time together today. What does it mean to be mission-led? How does it influence leadership? I personally made the decision 10 years ago professionally to devote the rest of my career to being mission-driven. And for me, that meant looking at how what I was giving my energy toward could give back to the communities to advance a calling greater than myself. When considering the opportunity of HFMA, when it was presented to me, I saw that two things. One, healthcare was so absolutely essential to the communities, that ability to impact was significant. But two, from a business mindset, the reality that healthcare will not advance or improve unless it is financially sustainable. You can have the best innovation, you can have the best ideas, but in this day and age, if there's not the financial underpinnings, both of sustainability or the payment models, nothing's going to work and nothing's going to change. And so with that mindset of what does it mean to be mission-led and how does it influence leadership, it's not about you. So a lot of times people ask, like, what are the characteristics of a leader? Healthcare, it's got to be different, unless you're just looking out for your own organization. So different from that micro and that meso, where really the individual and the organization is first. What happens when you flip it to being mission-based and you're suddenly talking about all of the community? Given our position of strength that I said earlier, we really are at a very interesting place for HFMA. We have this opportunity that others don't. And not only is it because we're at a position of strength, but I was talking to several today. HFMA has never had a history of lobbying. We don't have a PAC. We don't go at things and say we're right and everybody else is wrong. Why? Because we're the numbers guys. We have the data, right? We look at things objectively, and we have a lot of answers that people want. And so as we're looking at the change that's coming in healthcare and whether or not it's financially sustainable, who are the folks that actually understand the financial impact of all this change and whether or not it's going to make things better or worse? Finance people, yeah. So the moment is here. So the moment is here. And as we go through this data, the change that's coming, that bigger question of, is anybody else looking at this? Like, this industry is being attacked. You know, it's going to grow to 20% of GDP. That's a lot of money. It's bigger than the entire economy of Germany or Japan. That's healthcare. Is anyone looking out for the macro evolution of this industry? So with that background and where we are today, what do we do? So we're going to start a series of Slidos, and this is where I can actually compare not only you with what our board is, but actually some of the biggest thought leaders in healthcare right now. And I'll align that to some work that's been going on behind the scenes for the past 12 months. In one word, describe the U.S. healthcare system. Spoiler alert, usually when I do this, the words are not positive. Complex, broken, frustrated, fragmented, complicated, unknown, desperate. Yeah. Chaotic, that's a good one. So these aren't necessarily viewed as words that are positive. And all of them, usually, when I see them, there's a sense that makes your nervous system on edge, right? Not only are they negative, but there's this energy there that makes you uncomfortable. And so what do we do in response to times when we're uncomfortable and we need solutions? This is one point of leadership that I think is critical, particularly within this group. Go with the data, go with the numbers. And so as we're looking to find the North Star or the purpose in what we're doing, it's best to understand things by getting data. Little over a year ago, walked into the doors of HFMA, newbie, and there were some strategies in place, and I said, let's hold the brakes, let's collect new data before we move forward. And we were fortunate to amass a group of 30 true industry and thought leaders in healthcare. You couldn't get a more powerful list. Put them under NDAs and said, we want to pick your collective brains so that we understand strategically where we need to go as an association. And a good chunk of those people had nothing to do with HFMA, right? They were CEOs, they were different business professionals, CEOs of other associations, the biggest folks we could get hold of to find out what's going on. And we started off with a series of questions to take a pulse. And it began with this one. And it said, is the U.S. healthcare system financially sustainable? And the way they describe sustainable is whether or not the delivery of care could be maintained without exponential increase in spending, right? Getting past that tipping point where affordability wouldn't be there. And so we asked this group, again, we'll take your feedback here, I'll give another second. This was the starting question of where we went. Let's just understand, are things beyond repair? 8%, 12%. So right now, 88% coming in around no. So when we asked this group, it looks like the numbers blurred a little bit, 94% of the top minds in healthcare said this puppy is not financially sustainable. That's alarming in terms of understanding where we go. So that triggered other questions. So I'll get one more and then you're going to see a lot of data from me. Is there a true leader among the stakeholders comprising the U.S. healthcare system? In the 80s, say no. 85. All right. So I'm going to cover a bunch of data with you now to get a pulse of where it is. For that one, is there a true leader in it? No, is the overwhelming answer, which again is alarming when these are the leaders in healthcare allegedly. But some of the other points that are relevant asked whether or not in the next 3 years healthcare would reach an existential tipping point beyond what we have before. More than 50% said yes. Another massive one, in the next 5 to 10 years, how would you describe the change? Evolutionary, which means within the stakeholders that currently exist, or revolutionary, which means stakeholders that haven't been in healthcare. More than 50% are going to be from outside healthcare. So that means we don't know these animals and they don't know us. So you want to talk about disruption? I was privileged to be in a room a month ago where a well-known national disruptor wanted to talk privately with large system CFOs of HFMA. And the conversation started out with our CFOs politely saying, "You're not understanding, this is how the system works." And this very well-known public figure responded, "You're not understanding, I don't care. I'm here to disrupt you." And so that idea of what's going on in healthcare and the influence of outsiders that don't understand our system, what does that mean? Question, are policymakers or other convening organizations effectively advising healthcare stakeholders on ways to look at financial sustainability? Almost 90% said no one's addressing this. And then finally, should HFMA, again, most of these folks were not HFMA people, should HFMA be involved in this advocacy, not lobbying, but advocacy for change? This was surprising. 80% said yes. Kind of said the strength of our organization among those outside of us. Other supporting questions. What market pressures or macro forces have the most potential to accelerate value transformation? This one shouldn't surprise us, technology and information, right? Think about everything going on in AI right now. Which healthcare players will play the biggest role in catalyzing value transformation? This is where it gets really interesting if you're us. The bottom of the list was professionals and administrators. The top was employers. Do you want to know who doesn't want to know how to do this stuff? It's employers. They want to be employers. They don't want to be healthcare specialists. So what does that mean in terms of who we look at for collaborators if we do want to see this transition to value-based care? And finally, which of the following is the most effective way to drive financial sustainability? 1, technology enablement, not a surpriser, but 2, payment models. Who knows payment models? That's us, right? So as we start collecting all this data to understand for the first time what's HFMA's opportunity outside of our own walls, this is a pretty interesting puzzle to start putting together. So starting with our board of directors, then we go back to the drawing board and we say, what should HFMA's greater aspirations be in response to the modern U.S. healthcare environment? You know, we've had 77 strong years of looking at how we advance the mission of financial management. What's our calling going forward, given our position of strength and our knowledge? And that can be a scary question. But for me, part of my job, I guess if you have to do a leadership trait analysis, is to see potential in groups or people that maybe they do not see in themselves and create systems to advance it. So we've begun a journey at HFMA of looking at these future aspirations. And one of the slogans that came out is to stop solving problems. I was in a room once with a lot of association executives, and someone made the comment, associations are awesome at admiring problems. We convene on problems, we write articles on problems, you know, we have small groups that talk about problems. We're really, really good at that. We're really good at that. How can we stop admiring those problems, right? How do we become solve-based? So the dialogue now switches to how do we, 1, provide exceptional member value to our 132,000? How do we engage them? And 2, how do we become problem solvers? How do we convene not only ourselves, which we've done so well, but the others around us in the healthcare industry to look at some of these needs, these substantial needs that we have now, and what people say is about to come our way in the next 5 years. So I told you we went to this group of experts, HFMA did. We gathered all this data. We really went into the trenches. It was a lot of work that I thank a lot of people for going through with me. And we came up with an incubation concept. And part of this is what you're going to see HFMA begin to roll out over the course of the next 12 months. You are the first people to see this outside of the leadership of HFMA. You are my testing grounds for some of this. We're going to be discussing it at annual conference in Denver in June. This idea came up of what can HFMA be outside of itself that is a solve-based convener. And a lot of research was done. And first there was the concept that in order to create a safe space, people need to be able to walk into a room and not feel like someone's dominating the conversation or there's already a preconceived notion of who's going to win. So for purposes of solve-based convening, the word vitalic health came up. A word that we can use that's safe to say we're inviting everyone to the table. We don't know the answers, but we're going to do our best to provide what we can to benefit everybody. So Vitalic Health, it's an incubation initiative that HFMA is going to kick off that strives to advance financial sustainability and better outcomes in U.S. healthcare at that macro level. It's going to coexist with the mission of leading the financial management of healthcare. Not for everybody. A lot of people really, and particularly our younger members, are at the point where they need the professional development. But in order for HFMA to have learnings to bring down to our local communities and our chapters and our leaders, we need to say that we are actively participating in what's going on at the industry as a whole. Otherwise, we are simply followers and we are reactive. So how do we make sure that we are bringing together the right minds and contributing at what we can? This concept emerged from that group of experts. They're called the Healthy Futures Task Force. Again, pick things that are neutral. No one can be against healthy futures, so we're using that type of terminology. And it also included a good chunk of HFMA's board of directors. Building upon that concept of solve-based convening, this whole incubation process is going to look at HFMA's opportunity for impact among external healthcare stakeholders to improve the greater industry. And the aspirational vision is that contributions in convening, we can revolutionize business practices and payment models that advance health and equity in our populations, and then bring all those learnings down to our membership to improve our communities. So when we're looking at being solve-based, again, as a systems design person, one of the most critical elements is to define the problem you're trying to solve and to measure it. Why? Because if you can't measure something, you don't know if it's getting better or worse. One of the other shocking realizations to me when I started on this journey was to understand how are we measuring the macro advancement or decline of the U.S. healthcare industry? What index or measurement is out there that says year over year, why are trends going up and down? The scary answer is there isn't one. So going back to growing maybe to 2030 to 20% of GDP, where is the macro index that looks at the economics underlying U.S. healthcare and comparing it to outcomes and saying, are things getting better or worse? There wasn't one. So that's a problem. I'm going to go forward first and then come back to these, and you'll understand why. So part of the Vitalic Health mission was to say, if we're going to be solve-based conveners, what is the problem and what are the components that are really critical at the macro level? Not understanding a specific hospital succeeding, right? Or another actor within the healthcare industry seeing improvement. Overall, overall views of trends in healthcare. And part of what's being piloted is looking at it in two different components that then you can mix and match on an axis. One, affordability, and that culminating groups of patient satisfaction, economics, and affordability. The other is functional longevity, public health, environmental, and social and well-being. And there's mad statistics behind all of this and groups of people working on it that are far more intelligent than I am, that built the measurements to create the first ever index that looks at the macro level of healthcare, going back to the greater problem of accelerating expenditure without improved outcomes, right? That's part of the mission. You're the first group to hear this at the local level. HFMA is going to launch this summer and send it out for public comment period across the entire industry. Because we're not saying we're right, we're saying we're trying. And so if we can't understand the components that are showing the impact of different things as we reach this state of dynamicism that's coming, if we're not measuring it, we're not comparing, does it get better or worse in terms of affordability or functional longevity in those areas, how are we ever expected to know if the deliverables will improve? What are the deliverables? Who should win? You can imagine some of the controversy of this was saying we should view hospital metrics. If hospitals are healthy, we win. And the pushback was like, no, not at this level. Not at this level. Because we need to even understand how that comes into play. We need to read the other data first and then look at that when we go regionally. So phase one, let's figure out the national scoring. Then phase two, we'll hit down regionally. We'll bring in Medicare, Medicaid, hospital ratings, all those things at the local level. But when we're just looking at this nationally, what do we do? So going back, I'm going to get a couple of these from you guys. So tracking a little bit of what the really, big names in healthcare said, I want to hear a little bit about your thoughts on what factors do you consider most significant for the following industry imperative? Just looking at financial sustainability. If you had to pick one measurement that you feel is absolutely essential, the first one is healthcare cost to GDP ratio. Second, Medicare trust fund solvency. Third, workforce wage inflation. Fourth, demographics. 5 is others. I'll give a little time on this one, then I'll move ahead a little bit to get further in. Healthcare cost to GDP ratio holding strong. That's pretty consistent. Okay. We'll do one more. Let's talk about health outcomes. There is so many different opinions on this one. We really had to do a lot of research. Which of the following factors do you consider most significant for the following industry imperative? Health outcomes. That's been expanded to functional longevity. First one is rates of obesity and chronic conditions. Second, infant and maternal mortality rates. Life expectancy at birth. And core quality measures. Rates of obesity and chronic conditions hanging up there. I also would be remiss not to acknowledge, obviously, the administration change has brought a whole new level of dynamicism to healthcare. And in putting together these measurements, being able to actually show accountability to some of these views, too. Over the course of the last month, this chart that you've seen, we started to plug and play all the various measurements and go all the way back to 1997 to look at the trends. Now, if you had to guess, I didn't put this slide in here because I don't think I did. I didn't. I probably would get in trouble for getting ahead of myself. So if you had to guess how the scaling on the area of national affordability, satisfaction, economics, affordability, whether that improved or did not improve since 1997, what would you guess? Did not improve, and it's pretty steep, right? This is where things got interesting, though. Going back to 1997, we did that intentionally, last time there was a balanced budget. Functional longevity. So all those buckets were broken down: public health, environmental, and social well-being. But when they were combined, what do you think happened in functional longevity? Up or down? The silence is intentional because I didn't even know where this was going to go. Spoiler alert, stayed consistent, hasn't moved. So the big picture takeaway from 1997 is, even though there is a drastic acceleration of expenditure and decrease of affordability, outcomes just stayed happy where it was. No matter how much money you threw into this, the needle wasn't moving. Crazy. I mean, just knowing that none of that has been looked at. And so how does that change our perspective as we look at problem solving and what types of solutions we need to be cognizant of? So it is pretty juicy in the affordability year to year as to why did you see an uptick, why did you see a downtick. Other things that got really interesting is, even though there was like an opioid crisis, right? Overall, functional longevity didn't really move because of it. The pandemic, COVID-19, there was a hit in national affordability a little bit. Functional longevity didn't move. Crazy. So it really puts in perspective what we're aiming at in terms of looking at problem solving. So, number one, thank you for providing your input. Again, this is just kind of giving you a mindset of what strategically HFMA is looking at in the future. We are tentatively going to call this a trend tracker. Why a trend tracker? Because unlike calling things an index, that means we know the answers and we're measuring it based upon something that's benchmarked with a body of knowledge. We're in the wild, wild west here. So not getting ahead of ourselves, particularly when we're going to go to public comment period with some of this. As a true leader, you know what you need to do? You admit when you don't know everything. Nobody knows anything on this, right? And so starting out saying, hey, look, we're going to try to measure this, and we are going to look at trends and understand maybe what moved the needle one way or another. But going back to that initial statement and quote, it also strives to drive discussion on the foundational problem in healthcare and how do we understand what it is, and use that as a basis to convene individuals to look at solutions. Not only will this kind of capture year-over-year trends, both cumulatively, but as I said, in the future, it will be piled on with local and regional measurements, particularly Medicare and Medicaid, so that we can understand the difference between communities. There's obviously a big difference between Spokane and Seattle in terms of some of these measurements. What are they and why? Those type of things that we can understand. Then, once we're able to measure the problems and understand them a bit more, let's move on to solving them. So the second component of the strategy that HFMA will be looking at, it's called swarm studies. Swarm studies, again, incubation concept. They're short-term convening mechanisms that identify a problem, risk, or opportunity among stakeholders and go through a problem-solving and impact analysis process to look for better outcomes. We are originally focusing on swarm studies for new or threatening industry factors, a source of instability or friction, an opportunity for standardization to improve stakeholder engagement, or a comparison between alternatives. Originally, when we started looking at this concept, you always learn, again, one of my leadership traits is anytime you throw out a new idea, get ready for the immediate response to be, no! And there's this element of, we can't do that, and then people calm down. Right? And so the first time when we were saying, hey, when we look at the scope of convening, let's just cut to the trace and get to the rub. Payers and providers, right? Let's say we're going to tackle administrative waste. Payers or providers are going to convene. You're telling me we're going to go to the tables with the payers, right? Didn't set well in a lot of rooms. And that's a problem, right? Because we're all stakeholders. And yes, we have reasons oftentimes to have that emotional reaction. But again, if there are willing participants that want to take care of these problems and see improvement, how can we do so in a safe way? Then it became expanded to, okay, it's not just payers and providers, it's everyone. So don't just look at problems, look at proactively putting in place solutions that you can go through with stakeholders. And so we decided to do this again consistently. There had to be a problem-solving framework. I'm not getting into that. But then what can we get out of these swarm studies that then can go out to the HFMA membership? We have 3 proposals that are floating right now. I want to get your opinion on how you feel about these. Again, there's a lot of data going on behind it, who would be involved. Which problem-solving opportunity would you most support Vitalic Health addressing in the healthcare industry? First one, standardizing the definition of a clean claim between providers and payers. Second one, collaborating with consumer patient groups to drive transparency and trust. Final one, advancing direct contracting models between providers and employers. So this one I actually really want your responses on, because this is live. I'm taking this one to the HFMA Board of Directors in 2 weeks. If it gives you optimism, I can also share, as I've been working behind the scenes with my team and some other leaders of the organization to get the response to these stakeholders, to these concepts. No one has said no. Isn't that fantastic? That goes to the credibility of this organization. You are seen as a source of competency, as a membership, and as a safe place to have dialogue. I expected to get a lot of doors shut in my face. It's been the opposite. It's actually been, well, how about instead of a phone call, you just come and we have lunch and we talk about things. And so it has been a pleasant surprise, and also makes me extremely excited about where we can go as an organization to build upon the member value that we have, but truly looking at being a leader outside of our walls, not because we know everything, because we're willing to facilitate a solve-based dialogue to improve. And in healthcare, one of our, I'll say, more provocateur board members made the statement that healthcare is nothing but a bunch of warlords competing against one another for self-interest. And in response to that, I said, well, then maybe the true sign of leadership is whoever builds the table and extends the olive branch. Right? Maybe that is what true leadership is in healthcare, particularly in response to the beginning data that says there is no true leader. Perhaps that's because no one has exhibited the right leadership qualities to move ahead. I love seeing this because that's actually the leading proposal right now, standardizing the definition of a clean claim between providers and payers. And yes, the payers are interested in this too. So how can we start kicking off some of this low-hanging fruit, standardize things, and share those best practices with all of you? That's what we're hoping to do for future value proposition. So my closing comments, and then I'll leave whatever time they give me for any type of question you have about this presentation, about HFMA, about me. It's a challenge, right? If you own the crisis and you take it on, that means you have the right to own the cure. And in our situation, it is not that we have the answers, it's that we can facilitate the solution. That takes courage, right? And it's not through a lobby, it's not through a PAC, it's not telling everybody you're right. It's the courage to explore these relationships in ways that are meaningful and beneficial, and from a neutral at times perspective. And then we take that to understand, as the financial management professionals, how can we make this all work in a way that is going to have this financial sustainability for our organizations and deliver on the promise to our communities. So embracing the opportunity to evolve and lead, that is a rallying cry right now, if we so choose to take it upon ourselves and move ahead. So that is the conclusion of the leadership speech, and perhaps my perspective of leadership might be different. It truly is not about me, it's not about any one person, it's the collective opportunity that HFMA has together. I am grateful for all of you that are members. I'm grateful for all of you that are member leaders. You are the lifeblood of this association. And if we have any, I call them HFMA curious, right? People that are not members that are looking to join, welcome to our community. You are in phenomenal hands, and look forward to having you as an official part of HFMA. So with that, thank you, and I'll take any questions you have.
Thank you, Ann. That was wonderful. So my question is around defining the stakeholders to bring to the table. Because when you think about healthcare affordability, I mean, you could expand it, tenfold, right? We think of, the political environment. We think of wage inflation. Certainly the payer dynamics, all those things. What is stakeholder? How is that defined?
So when we looked at stakeholder, we went back to the index, and then we did an overlay of all the different stakeholders that were engaged in that element of measurement. It's about 20. So that in of itself was a factor in us understanding when we look at dissecting this, who needs to be at the table and what's the expansiveness of it. So anytime we go into a potential swarm study, we pull up this map overlay that says, here are the stakeholders. And then that causes me to say, okay, legitimately, if this is going to be a solution, do we have them at the table? And making sure that box is checked. But to your point, you're absolutely right. The complexity of this, that overlay of all these participants, that's part of why there hasn't been progress, particularly when they have at times divergent interests. So one of the other changes about this convening is that there has to be agreement when we convene from what perspective is this being seen. And a lot of times that should be the outcome to the community, right? And that's not always a popular answer. For other ones, it's going to be administrative ways, right? That one's clean, like the payer, provider, some of those are going to be clean cut. But when we get to some of those others, like one of the original proposals was looking at the cost impact and outcomes of GLP-1s. The number of stakeholders involved in that one was just like, nope, not to start with, because it just got too complex in terms of who we were seeing on that one. So we are going to start with some of the ones that are easier to define. We're going to win some and lose some in terms of did it work. That's why we're going to call this incubation, then fine tune it when it goes mainstream. Yes.
This was wonderful. Thank you so much for all the numbers. I love numbers. I'm part of Creative Destruction Lab, which is in association with Yuda Foster. Because our company got selected there, we do the automation of the back office processes and all that in healthcare. So the question is, one of the mentor in the in the group asked me about how the automation is helping and all that, and where are we saving the money, because our automation is much more onto the compliance operations side and not on the billing side. And of course, I have so many friends here who are on the billing side. So he said one thing, and that correlates to the last, your question on the poll was there. He said that he was having one surgery and he went to UK, and the doctors gave him two bills. One was $14,000 euros on one paper, and one was $7,000. And he said that if we file through the hospital, the provider channel, it's going to be $14,000. But you take this $7,000 and you file it directly to the payer, and there is this big difference, because that $7,000 are part of our expenses to get the damn thing done, to get us paid. which is the bill you are going to take with you. And this, my mentor friend, he ended up taking the $7,000 bill. So he asked me this question, which I'm going to ask you today, because I didn't have an answer. I'm a very, very fraction part of this humongous, complex ecosystem where I envision to solve some problems. My question to you, Ann, is there something like that can be done in this complex bureaucratic system to really have the benefit for the patient? Because who matters? It's patient.
That's an excellent observation and question. And I think part of what you're saying comes down to are the stakeholders first willing to admit it can be done better, and then legitimately looking at solutions. And so that aligns nicely with the concept of how much of this national expenditure is waste, is administration that doesn't need to exist. And in this larger conversation of making sure there is affordability, that's a key component, right? So I believe what you are saying is exactly one of those issues as to why we need these problem-solving opportunities. One, right? The players need to come to the table and say, let's be real. This is what's going on, right? Also, admission that there's a lot of money being made off waste, right? That is also just a fundamental concept. And so moving some of these blocks and understanding what should be acceptable for standardization, promoting standardization. That's a fundamental element anytime you want to see a solution outside of four walls, standardization. But the other component I want to bring up that I think is critical is the element of public trust. So that conversation, I'm sure that you just referenced of him saying, you're telling me I can have 2 bills? I mean, that's infuriating, right? Like, I want to know how much this costs. Why would I have 2 bills? What's happening to that change of trust with the American public as they don't necessarily understand their bills, as they receive a denial, as they go through all this? You know, we do not need to relive the terrible events that happened earlier this year of having someone murdered, right? That is not acceptable. And so if that was ever a flag that we have reached a tipping point for public trust, right, it's there. And so the part of this dialogue of what does improvement look like, I think part of why it's critical is because we do serve our communities. And they are frustrated right now with understanding some of this. So what's our role? Even simple things like HFMA can do more, I think, to help explain to people, this is how you read your bill. You know, I'm in my role. My mom went through unfortunate health circumstances last year, and I really had to handhold. And I stepped back and I'm like, you know what? What's this process like for her? There were certain things I even had a hard time understanding, right? And so even simple things like that of what can our role be in establishing trust and empowering our organizations that we serve to establish that trust because we're giving them education on understanding financial management. That alone could be a swarm study. How does HFMA better work with our enterprise members to explain things to establish trust with patients? Boom. That's an easy one. So just taking that mindset, too, of getting outside of our four corners, and a lot of that then is a great opportunity for our chapters. You know, what can we put together to give those type of skills to build trust? Yes.
Now when you're, oh, sorry. But yeah, there's so much stuff that's going on in healthcare that when you see presentations for developed countries, we're the most expensive. But you know, the cost of care. But there's just so much stuff going on, but you're trying to bring people to the table. But what I see, it's still an archaic mindset. They still want to live in the past and don't want to move forward, but also, too, for the cost of care. I believe patients don't want to go to the hospital because it's expensive, but also, too, seeing that some of the physicians don't really care. They're seeing them for 1 minute, then moving on. Then the patient gets, what, a $2,000 bill, and they didn't feel like they got the service that they should be paying. So we're starting to see, I think, people starting to resist going to when they need help. And as we transition to value-based care and population health to keep communities healthy, to avoid this, but how do we avoid that when the patient, like you said, loses trust, not on the financial side, but the care through the physician side?
That's an excellent question. In this issue of the rise of, I'll just call it consumerism, that's not a nice word when you're dealing with patients wanting, the way they want it, right? But I'm just going to call that consumerism. That is going to be more of a movement going forward than less, particularly when you look at the generational tendencies coming ahead, right? They don't only want it their way, they want it on their iPhone and their color with their this at the time of day and 8-minute module. I mean, it's, whole nother level of expectation, because they will see healthcare just like any other service they're getting on anything else. And so this tipping point, again, of considering what does the future look like, I'll go back to some of that original data that said some of the biggest impacts are going to be revolutionary, not evolutionary. That means they're outside, they're disruptors. We don't even know what that means. That's the scary part, and technology is advancing so fast. And so being able to, one, listen and learn, I think is going to be absolutely critical. Because at the end of the day, the payment model to support whatever is coming, that's on us. That's what we can control. So establishing that dialogue effectively, I think is number one, to show that we're listening, but two, let us help you understand. But then that second element is being ready for change. I do think that is going to be absolutely critical. How many are dealing with, AI in one way or another? That's just the beginning, and it's going to accelerate. And so how are we willing to take these learnings and adaptations to go forward? So I agree 110% with what you were saying.
Because what you said, remember last year at annual conference when you had that side chat with that doctor?
Yeah.
And she did mention social media is becoming one of the competitors
Yes.
for patients, because it's easier for them and they're seeing these things that, I can cure
The
my
TikTok
sleep.
solutions. Oh, God.
Yeah. So
And then they end up in the emergency room.
yeah, exactly. So, but how do we? I mean, that's the other thing. How do we educate this next generation when they're going to be the ones accessing healthcare, when they don't really trust healthcare?
Yeah, mis and disinformation is rampant. By the way, Dr. Nair, I am proud to tell you, number one, if you haven't voted to adopt the HFMA incoming board members, we have to get X percentage of threshold. Please do it. The reason I bring it up, Dr. Nair is joining the HFMA board next year, because we do view that necessity of understanding technology, information, mis and disinformation is critical to the future to complement financial management. So she is joining our board. So everybody vote that hasn't voted yet. But that is going to become a more critical conversation. HFMA personally, I can tell you our organization is looking at how do we get ahead of that. Part of it to combat social media is us getting in media ourselves, right? That's new for us. We're piloting that. If anyone's in Traverse City, Michigan, we're piloting that right now in Traverse City, Michigan to see how it takes. But then how can we then provide that to the organizations to do it? I think I'm getting the hook, but if there's any more question. Okay. Well, I'm going to stay here because I learn as much as you give me. So I'm going to stay here as long as you let me.
Thank you so much for the presentation. A question on where do you see this ending? So let's say you get all the stakeholders in the room. We can use the clean claim example if you want. Mm-hmm. We've all agreed to a certain process, a protocol. What comes next? Are we talking about legislation at the state level, at the federal level, get a representative to sponsor? How do you see that coming to life?
Yeah, great question. So this goes back, my background, I don't like to talk about myself a lot. So before I was the CEO of HFMA, I was the CEO of ASQ, it was the Global Quality Association. One of our responsibilities was that we were the head of the global ISO standards for 9001 around the world, and a lot of process and systems design. So my background is process system design. So what I can tell you when you're looking at implementing solutions to promote positive changes in economy, which is a lot of what we did, it must start with the adoption of standards. And so when you're looking at things like that on agreement on something that is process and system driven, development of a standard is where it begins. To your point about then does it lead to legislation, one of the very interesting things about healthcare is how much are you going to wait and educate people that are controlled by lobbying and that ebb and flow with changes of the administration, or how much can it be the business industry itself coming together to almost self-regulate and agree here are the standards. And so for some of these initial testing periods, it's almost like we have to show the success as the industry, business to business, in order to take the data to the hill. And I think that's probably going to be the stronger way to see change. Again, I do think because of this lack of data and what we're doing, we can't go forward for something that's national at that level unless we show them the results. So once the standardization is in play, that should be sorted that, okay, per the numbers where we tested this, we saw a decrease in X amount of administrative waste and therefore the ability to put it where it needs to be or eliminate that from expenditure. Yes.
I'm going to say I love your idea of getting some of those stakeholders to the table and coming to, work rules that everybody can use. And then when that becomes an adopted standard, you can decide what to do with it. The weird thing about legislation is remember, legislators are not experts at any of these things. And I look at the auto industry, we all came to this conclusion that airbags save lives. So we put in airbag legislation and everybody had to have airbags in the front seat. And then lo and behold, airbags had standards about how fast they would deploy. And we found out, we were actually injuring low weight people because we were deploying too fast. And it took, after we knew that, and we could have made that change, it took half a decade to change it before we stopped, injuring smaller people, whether they're kids or just smaller adults. And I mean, it's important. We're already super legislated, super regulated, and you tend to suboptimize or follow rules that are out of date so often. I'm not saying we don't need legislation. I'm just saying we probably don't need legislation on everything. And if we can find ways to work, industry groups can adopt better work rules faster than you can get them re-legislated.
Excellent comment. Excellent comment. Yeah, I can take, it sounds like whoever is sitting on the best question ever can ask that question. And of course it's George. Of course George has the best question.
I don't know if it'll be the
day.
best question. It kind of ties many of these topics together. You had mentioned there was 20 stakeholders when we started the conversation. And I don't know if we're considering the food industry because that is a culprit for a lot of our diseases. There are other countries that are not as advanced as ours and have no extra ingredients or whatever you want to call it to cause some of the illnesses. So hopefully that's going to be part of the, but I think it's going to come down to collaboration. Everybody has their silos. So you've got obviously pharmaceuticals, the payers, food, us as providers, et cetera, et cetera. Did we also consider the consumer as part of that collaborative effort?
We did. And part of the conversation is how do we get the consumer voice? There are also groups looking at from our traditional hospital standpoint that have been downright vicious towards us. And there might not be a way to bring them to the table, right? And so to that point, how did we look at making sure that voice is heard? And we've had all sorts of ideas. Like one of them was in certain groups bring in ARP. And other, so trying to look at where can we have a right segment of voice that isn't adversarial. I mean, because we all know some of those groups out there that are just kind of out to get and to say so-and-so is the enemy. That's not where we want to start this. And that's a very good point. So we are trying to be thoughtful during incubation. I call it an army of the willing. Right? You have to be willing to admit there's opportunity to improve before you come into this environment to seek change. I think that is it. I just want to thank you so much for allowing me to spend time with you. I really appreciate all of this feedback that I have. This is going directly into our planning, and just to thank you for being members again.
Thank you, Ann, so much. We are so lucky to have Ann Jordan with us, and to thank her for being here and for getting our feedback and for allowing us to be test agents. I'd like to present a certificate for her. We're making a donation for the California wildfires in her name, and also providing her with the Washington, Alaska flag from HFMA for her to take back. Thank you. Thank you, thank you.